Okay, I think we're doing some troubleshooting in the background. That should catch up to us in about a minute here. So let's get started. I'm going to turn it over to Jack Lee to start us off. Jack, over to you.
Okay, well, good afternoon, everybody. Sorry for the technical difficulties we're having, but we can get underway. I am Jack Lee with the Saskatchewan Public Safety Agency, and I would like to welcome you to the second of 2 virtual town hall meetings for police, fire, EMS, and other first responders. On behalf of the Saskatchewan Public Safety Agency and the Saskatchewan Health Authority, we would like to take this opportunity to thank you for your services to the people of the province of Saskatchewan. That is one of the reasons why we've asked you to participate today, just to show our support, and we know there's a lot of questions out there and concerns, and that's why we're here today. So over the next 90 minutes, we would like to provide you with some information to help alleviate some of those concerns you have, as well as answer some of the questions that we know you all have. The process we're going to follow is this: there'll be a presentation at the beginning, a PowerPoint slide, and after that portion, what we'll do is open the floor to your questions. And then at the end of the question and answer part, we'll provide you with some resources that you can use to further answer questions that you may have or have not had answered here. During that 90 minutes, if we don't have enough time to answer all of your questions, we can guarantee you that one of the things we will be doing is sending out the written questions and answers so that you have that. So with that, I'll turn it over to Amanda to talk about some technical info on how we're going to go about asking questions and stuff. Amanda?
Thanks, Jack. So hello, as Jack said, my name is Amanda Delk. I'm a manager of project delivery here at the SPSA, and I'm thrilled to be your host today. Thank you again for joining us, and just to repeat, Jack, we apologize for the technical difficulties we're facing here. Hopefully we get them out of the way right at the beginning. So this session is tailored to the unique concerns that your organization may have in discharging their duties in the COVID-19 pandemic conditions. We recognize that you all may have questions that fall outside of this, so we'll address those questions near the end of the session, or like Jack said, we can do some follow-up afterwards as well. Before we get started, I just want everyone to please take a second to jot down this phone number in case you're disconnected from the call. So I'll read it out to you. It will take you directly to this Zoom meeting over the phone. So it is 1-647-558-0588, and the meeting ID is 337-930-981. Again, that number is 1-647-558-0588, ID number 337-930-981. So like Jack said, we have a panel today who will be providing a PowerPoint presentation to start us off. They are all from the Saskatchewan Health Authority. Unfortunately, this presentation means that those of you on the phone will not be able to see the presentation. So I'll just ask our panel to keep the phone participants in mind as they walk through their presentation. During today's session, please feel free to ask questions in the chat feed. You'll find the chat icon at the bottom of your screen. Once you click on that icon, the chat box should open up for you. So questions will come to, will be seen by everyone, and I'll read them out for the panel to answer. If we don't get your question during the session, we will send it to the panelists for follow-up at a later date. And just as an FYI, because we have so many participants on the line today, that's why everyone's been muted, and we've asked for the video to be turned off. So if you're joining by computer, please do not unmute yourself or turn on your video. This will help us conserve bandwidth and just allow for the meeting to flow a little bit more smoothly. So if you are phoning into the meeting, we'll provide an email address, like Jack said, at the end of the session where you can send your questions into. Given the large number of participants, we're just not able to open up the line to verbal questions. So hopefully you're able to have your question answered during the session, but if not, we will have an opportunity for you to send those in. So I would now like to introduce you to today's panelists from the Saskatchewan Health Authority. Today we have Felicia Watson, Executive Director, Patient and Client Experience, Dr. Julie Krzyzanowski, Senior Medical Health Officer, and Patrina McGrath, Executive Director of Quality and Safety. So with that, I will turn it over to Felicia Watson to carry us on, and I'll just ask our technical coordinator here to unmute our panelist.
I can hear you yet. Oh,
so Felicia is unable to. Are you on, Felicia?
We can hear you now, Felicia.
I think they can hear you now. Okay, we're going to test it now. Okay, Felicia, try.
Good afternoon, everyone. It's Felicia. Can you hear me all right?
Yeah, we can hear you.
Perfect. Hey, thanks, Amanda. As Amanda said, I am the Executive Director of Patient and Client Experience, and that's my usual day job, but I have been transitioned into supporting the Emergency Operations Center for the SHA as Liaison Officer. So I'm here with some of my colleagues, and we'll be covering a short presentation today. And a few of the topics that we'll be going over quickly are just an overview of the SHA pandemic structure and our response, population and public health strategies, protective equipment and occupational health and safety. And then we have a few frequently asked questions that we'll review for you. And then we'll go into time for you to ask your questions. So I want to thank the Saskatchewan Public Safety Agency for the opportunity to partner with them today on this presentation and this town hall. As we've been supporting each other through pandemic planning and our response, it's been really important to partner with our different agencies. So I want to thank them for this opportunity. Within the Saskatchewan Health Authority, we have been reacting to this fast-paced pace of change. And although we have been preparing for emergencies and are always prepared to adapt our model of care, everything has been moving at a really fast pace. So a quick overview of what we have been doing. We have a centralized and coordinated approach to managing emergencies, and our emergency pandemic response is coordinated through our Emergency Operations Center. We have the Provincial Emergency Operations Center, and we have 4 integrated health incident command centers that are responsible to operationalize pandemic planning across the province. So you can see how our SHA Emergency Operations Center links to the Provincial Emergency Operations Center, which has representations from all government agencies, departments and crowns. And we also link to the Ministry of Health Emergency Operations Center. Our SHA EOC is supported by our 4 integrated health incident command centers. There's one in Regina, one for Saskatoon urban, one for the north, and one for the rural. And those 4 incident command centers are really responsible for developing the operational plans that support the strategic planning that happens at the Emergency Operations Center level. Within each of those integrated health incident command centers, there are EMS directors and leads assigned to support that work. And those of you that do have the visuals can see the slides that demonstrate how that connection happens, and all of the roles and responsibilities within the EMS Incident Command Center. The SHA strategy to respond to the COVID-19 pandemic really it's a 3-pronged strategy. And the first is to contain. So when we're thinking of contain, we're wanting to detect cases as soon as possible. So to do that, we're increasing testing, we're enhancing surveillance, and we're testing for COVID-19 for all declared outbreaks in long-term care homes. The second part of our approach is to delay community transmission for as long as possible. Those strategies to delay would include self-isolation and aggressive contact tracing. And the third part of the strategy is to mitigate, which means preventing the spread of COVID-19. So some of the actions that we're taking here include the education of staff on personal protective equipment and how to care for those who are suspected or have confirmed cases of COVID-19. We are focused on expanding our capacity for COVID-19, and there has been communication shared around some of the strategies that we're taking. We are dedicating spaces to cohort COVID-19 patients. We are planning for COVID-19 designated hospitals, including field hospitals, and looking at additional community-based acute care capacity where required. So a bit of background about our pandemic planning, and I'll turn it over to Dr. Julie Krasnowski to talk about public health and population health strategies.
Hi, good afternoon, everyone. This is Dr. Julie Krasnowski. I am the Senior Medical Health Officer with the Saskatchewan Health Authority. So I'm very happy to provide an overview of some of the considerations that are part of our public health and population health plans and strategies to address this pandemic response. Next slide, please. So with the provincial pandemic response to COVID-19, the metaphor of a football game has often been used when we talk about our offensive strategy and our defensive strategy. And our defensive strategy is making sure that the healthcare system can be there to provide the care and service people need if and when they need them, including emergency care and critical care for severe illness. But our offensive strategy is critically important as well. And this includes some of the public health measures that are necessary to flatten that curve and make sure that we're not overwhelming the capacity of our system. And our offensive strategy includes some key strategy components, including the day-to-day work of public health, which includes aggressive contact investigation. So what that means is that for each case of COVID-19, public health follows up with those cases within 24 hours to identify who might have been contacts. They do a risk assessment to determine who is a close contact, who is a non-close contact, and who, because of their exposure, is deemed to be not a contact. And then they provide appropriate counseling and advice. That may include a requirement to self-isolate for a 14-day period and or self-monitor for a 14-day period. And should anyone develop symptoms during that 14-day period time, they would be followed up to determine whether they themselves are cases. So this is the work of public health, but also we're working to make sure that work is aligned with similar work done by infection prevention and control and occupational health and safety. Another important piece of the offensive strategy is to ensure people are adhering to the orders issued by the provincial chief medical health officer. So this includes both increasing awareness of the importance of things like social distancing and limiting the size of mass gatherings, further restricted to just, limiting the size of mass gatherings. Also thinking about what are the practical supports needed to support people in following these orders, such as decreasing barriers that are presented by living in overcrowding housing situations or not having a home to go to self-isolate. We also understand the psychological stress of requiring people to self-isolate and social distance for the extended period of time. So making sure that we're attending to those very practical needs that support health and well-being. And then another piece of that is enforcement of the Chief Medical Health Officer's orders through public health inspectors, working closely with our law enforcement partners. And then last but not least, this is really important, preventing people from getting sick in the first place. So while we're trying to decrease community transmission, it's also really important that people are doing what they can to keep themselves well. So some of that is health promotion, so making sure that you are taking care of yourself, keeping physically well, but also mentally well and healthy, so that we can come through this stronger on the other side. A critical piece of this is hand hygiene. I don't think I can say more strongly that that's really important, that people are following good hand hygiene, both in the workplace, but also in their personal lives at home. Next slide, please. So within those population health strategies, there are specific subpopulations that are more at risk. So healthcare workers are one of them, and that includes broadly defined both people who provide health and care services, but also our first responders. So police and fire and EMS, correctional services officers, and all those who do the very important work that you do every day. We know that in providing those types of care and services and supports to the community, you may be at risk for exposure to people with COVID-19 and potentially present a risk of transmission to populations at risk, whether symptomatic or even perhaps if asymptomatic, because we know that that is a risk factor that has been shown in some cases of COVID-19. So to address those risks of healthcare workers, some of the key strategies there include doing screening for healthcare workers, and this may be through symptom checks to see if people have developing symptoms of COVID-19, and if they do, making sure that they're prioritized for testing. Another key strategy is having processes in place by which healthcare workers who may have been exposed to cases of COVID-19 can be monitored by Infection Prevention and Control and Occupational Health and Safety. And then as part of an overall human resource management plan, thinking about what needs to be done to plan for a workforce absenteeism rate of 25% or more, given that we know healthcare workers are a significant proportion of our population, and we expect that they may be infected at the same rates as the rest of the population as well. Next slide, please. Another population that is also at increased risk are people who are in congregate living situations where the virus can spread readily amongst people, but particularly like long-term care and personal care homes or seniors living complexes where people themselves are at underlying risk for severe outcomes, including deaths. So some of the key strategies that are being put in place there are restrictions on visitors. Again, screening through symptom checks and prioritized testing for people who either live in these congregate living situations or are providing care and services, whether paid or unpaid, formal or informal. And then should there be cases of illness amongst people who either live or provide care in these congregate living situations, rapidly recognizing the potential for an outbreak and responding appropriately. And this may include cohorting residents and staff. Next slide. So with respect to prioritizing testing for healthcare workers, we are recommending that anyone who is a healthcare worker or first responder be alert to the signs and symptoms of COVID-19, and should they think they are developing symptoms, be presenting for testing. The SHA has established a number of testing sites that are operating across the province in the large centres of Regina and Saskatoon and Prince Albert and Moose Jaw and Yorkton and Swift Current and Weyburn, but there are many more sites that are being open across the north and the rural areas of the province as well. And currently the testing is a referral-based service. So people who require testing can get a referral either through primary health care or home care or their family physician to be tested at one of these assessment sites through a booked appointment process. Next slide, please. So there are priority populations for testing, and I have talked about healthcare workers and first responders with respiratory symptoms, but it also does include people who are being admitted to healthcare facilities for acute respiratory illness, or those who are requiring intensive care for severe acute respiratory illness. And again, important to recognize cases of respiratory illness amongst people who are living in congregate living situations as well. So all of these categories are being prioritized for testing, although testing is available to anyone who does have symptoms.
Thank you, Felicia. Katrina?
Hi, good afternoon, everyone. So as Felicia did, my day job is, I'm Katrina McGrath, and my day job is the Executive Director of Quality and Safety. And in our EOC structure, structure within the SHA, I sit in the role of safety officer for the emergency operations. And so you can change the next slide. And so I'm going to talk a little bit about PPE, supplies, and what's appropriate. So it's really important to understand that COVID-19 is spread through droplets. One of the key things is it's often spread by, you may touch your mouth, touch your face. Those are always things, as Julie was reiterating how important it is to wash your hands. So in the day-to-day, not touching your face, but washing your hands. When you are at work and you are in a situation where you are not able to be at a distance of 2 meters and you are caring for a patient or an individual, then it's important to put on the droplet precautions. And on this slide, you will see that the droplet precautions are a gown, glove, procedure mask or surgical mask with eye protection when you are within 2 meters of a patient. And there also is procedures that you do or we do in healthcare that are called aerosol generating medical procedures. And those procedures are where we need to have an aerosol protection. And in those procedures, we would be using an N95 mask and shield. And those are those masks that need to be fit tested, particularly to individuals. So just important to understand that most of us would, working with a patient, need droplet precaution. And then there are some groups of workers that are doing more the aerosol generating, and they need another type of PPE, added PPE. It's really important, it's really important that safety is the #1 important of our employees and our physicians, residents, and emergency workers. So understand the type of procedures, the type of contact that your workers and staff will have is critical important, and then identifying then what type of PPE or if PPE is required. And in my team, we work between infection control, occupational health, and supply chain to focus on getting the right PPE to the right provider at the right time to provide that critical care to patients. And it's a really important connection between the provider and the patient, and also the right level of PPE. You can go to the next slide. Oh, sorry, this one's good. Go back again. So one of the things that we are doing in the SHA is we've put together is a PPE task force, and they're actively working on developing and advancing solutions and contingency plans to ensure that staff have access to the right PPE at the right time. Next one. So a few things that are happening through that task force is modification of our supply chain distribution to be able to track and control the distribution of PPE. We are really putting in controls and ways to know what we have in our stocks, what's coming in, what's our orders, what's the estimated time of arrival, and really begin to put some strong controls on those. One of the things that's really important to think about when we're thinking about the PPE use is that we want to make sure we're using it appropriately, because anything we do today to waste or to use PPE when it's not needed could potentially impact our healthcare workers in the next 2 weeks or 3 weeks to address the situations and different phases of the pandemic. So it's critically important that we are both conserving and really making sure we're utilizing PPE appropriately, and that we have some controls on that and really understand our stock at any one time. The other thing we're doing is around distribution guidelines. So we have guidelines, and you can find those on the Saskatchewan.ca COVID website. We're also doing work around ordering conventional, so the usual disposable gowns, masks, gloves, and non-conventional. And those are more the idea of reusable respirators, N95s from other jurisdictions. So other PPE products that we may need to have on stock and have available should we have to shift or change, or something happens to our supply chain that requires us to quickly pivot and move into another form of protection that we need. And then also engaging other industries to identify new orders, opportunities to order PPE. So really looking with our distributors around what is the PPE used in mining and other outside of healthcare that may also serve the same protective process, and how do we look at different ways of ordering those types of as a backup for our PPE supply. The other piece is really about connecting with the donations. We have such an amazing community in our province, and the donations that are coming in and being able to use those donations to put a call out to our community to further get donations where we need them, when we need them, is such an important piece of us understanding the whole of supply chain and having the right information and the right products. Implementing distribution of pandemic supplies from 2009. So we have a warehouse. We have pandemic supplies that have been there and have been under temperature controlled and have been in our province. And so we are working through how would you use those, when would you use those supplies. We've done testing on those supplies to make sure they have integrity and that they will protect our workers and our physicians. So then the question is when do we pull on those? What would be the trigger to start to use those type of supplies? Collecting ideas on how to do 3D printing of various types of PPE. We've got 3D printing of face shields right now that we're just testing out to see. And again, we're doing that right now, not because we've run out of face shields, but because down the line, we want a contingency if something should happen with our supply chain that we may need to have an alternate route. And so right now we're working on testing those things to make sure that they're going to provide the protection that we need. And then we'll decide when we need to pull the trigger to produce them in larger quantities. We're exploring innovations and emerging best practices to conserve PPE. We have SHA Ideas, which is a website where we can crowdsource ideas from all over the world, and staff and community members can put in ideas that they're seeing in the news or connections to new evidence, or ideas that we're testing in clinical areas where staff are looking at how can we conserve the number of masks we use, how can we decrease the number of times we have to go in and out of a room. And you see all kinds of amazing innovation happening all over the world and in our province as well. So important again to really think about not only having the right PPE at the right place, the right time, but conservation. How do we minimize the number of gowns we need to use, the number of masks we need to use in any one day? Next slide. So PPE guidelines for emergency services workers. Many of the tasks performed by workers may not require PPE. As I said, that if workers are not coming in close contact, they can stay 2 meters away. Then we do not need to put those PPE precautions in place. So that distancing is really important when you may be with somebody that may be suspect of having COVID-19. When you do have to come though within contact with them and it's less than 2 meters, important to take those precautions and use that droplet precaution PPE. Another really important piece is PPE alone. It will not work if it's not applied correctly, if it's not put on correctly, and if it's not taken off correctly. We actually have probably the biggest risk is doffing or taking off PPE. If people are not trained and aren't doing it properly, there's a great chance of being contaminating yourself while you're taking it off. So I really encourage people to go to the website where we have videos and donning and doffing visuals so that you can really help each other and see each other do the donning and doffing and make sure that you've got each other's back and you can support each other in doing it properly. PPE must be removed and disposed of safely to ensure no opportunity for infection. And again, really important piece to keep yourself safe. And then employee guidelines and instructions for safe use of PPE, as I mentioned, can be found on sas.ca/COVID-19. We know that things are changing rapidly, research is changing, information is changing, and that is your best place resource for that information, to be able to make sure that you have the latest information that will always be updated first. So PPE requests for emergency service workers, the Emergency Operations Center is coordinating all PPE requests, so orders can be sent through SPSA at gov.sas.ca, and in the subject line you should be indicating non-health PPE requests. And the work between the SPSA and health will coordinate orders, receipt, and distribution. Distribution is based on priority, so healthcare practitioners first, then other priority groups like first responders. So we're working closely with our colleagues in ministry and cross-sectoral to really ensure that the PPE we get into the province is distributed and allocated in a well-coordinated way. Next slide.
All right, thank you for that. Jack, did you have anything to add on to those last couple slides?
No, I think she covered it. Just it is important to note that with this pandemic, one of the issues around PPE is that it's not just this province that's looking, it's every province in Canada, territories around the United States and around the world. So you put your order into the SPSA website. It will be looked at, and we will try to get you supplies as we can get them. We just don't want you to think you can put it in today and that you'll have it tomorrow. But we will work very hard to get it to you. That's all I got.
Thanks, Jack. Okay, Dr. Krzyzanowski, turning over to you now.
Hi, thank you. Yes, so with this next section of the presentation, we're getting into the questions and answers, and we've pulled together some of the most commonly asked questions, and I will do my best to respond. And then there's time to also respond to questions coming in through the chat. So the first question was about the recommendations for emergency service workers for basic personal safety and what some of the considerations might be. The recommendations are the same as what Petrina had described earlier. I again want to underscore the importance of while we need to take measures to ensure our personal safety and make sure that we're protecting ourselves from the virus, we also need to be doing all of the things that we need to do to stay well and healthy and strong. So remember to do all of those things, including taking time to rest, taking time to connect with family and friends, taking time to eat well and exercise and manage your stress in healthy ways, because I do understand the pressures of working at the front line, particularly because we are in this business because we care about people, and that can take a toll on our health if we're not taking care of ourselves first. So take care of yourself. Practice excellent hand hygiene, again, in the workplace and at home. Practice social distancing as much as possible, and again, in the workplace and at home. In your line of work, do what you need to do in terms of basic precautions, and then also a point of care risk assessment. And I think it's important to understand the importance of eye protection as well, because that is sometimes underestimated as a route of transmission. And then if you do develop any symptoms of COVID-19, it's recommended you be tested. And like I said, there is priority testing available for healthcare workers. With respect to the proximity recommendations, that's the same as the guidance around social distancing. So a distance of 2 meters is recommended to maintain that whenever possible. And then again, the PPE equipment should be considered through a point of care risk assessment based on the work you're doing that day. Another question we're often asked is, what is the transmission risk of the COVID-19 virus in the environment? So through inanimate objects like paper or objects that you would touch in your line of work. And there have been studies that have looked at the virus viability in the environment. Some of that depends on what the surface is. as well as temperature and humidity and other factors in that environment. So based on those, it's thought the virus can survive for a period of hours or to a few days outside of the body. We're not clear at this point how much that contributes to it being a potential route of infection, but that risk exists. But again, what you need to do is to maintain excellent hand hygiene. If you're touching objects in the environment, that in and of itself won't infect you with COVID-19, but if you touch objects in the environment and then you touch your face, you touch your eyes or your nose or your mouth, and you are contaminated, that is the route of transmission. So you can avoid that by practicing really excellent hand hygiene. Next slide, please. So the next question is around testing. So again, if you think you have symptoms of COVID-19, please do get tested. We are recommending that if possible, there is a delay between onset of symptoms and when that test is collected of 48 hours, and that will help us reduce the risk of a false negative test. And that will help us conserve our testing supplies and capacity to do the testing. But certainly we would encourage you, if you do have symptoms, to be tested. If you think you might have been exposed to COVID-19 because of an exposure in the workplace or in your personal life, the advice is the same. But if at work, you should be notifying your supervisor and following the directions of your workplace occupational health and safety around any policies that you might have. And then similarly, if you feel that you're at risk of COVID-19 in your line of work because of the work that you do or because you're going into a situation that seems to be particularly risky, again, this is something that you need to be working with your supervisors and following your workplace policies and working with your workplace occupational health and safety to help mitigate those risks.
Thank you. So thank you to our SHA panel for the presentation part of today's session. I'll now open it up for questions from participants. Just a reminder that there is the chat icon on the bottom of your screen. If you click on that, you'll get the group chat box opening up so you can see the questions there, and that's where you'll type them in. So we'll get to, right now we just have one question in there, and it's about, will fire departments be able to get a minimum order for appropriate PPE in case of response? So I think Jack spoke to that already, that orders can be sent in to the SPSA at gov.sk.ca email address. And if you have a subject line of non-health PPE request, the SPSA and health will be coordinating those orders and the receipt and distribution of the PPE as well. So Jack or anyone else on the panel, is there anything else to add on to that question or response, sorry? Okay, I'm going to take silence as a good thing. I think nailed it. So we don't have any other questions that have come in right now. So I think that I will turn it back over. Sorry, can we flip to the next slide, Kathy? Oh, we got one. Okay, let's just stay here. Next question is, what else should we do if we respond to an incident if we don't have appropriate PPE? Great question. Katrina, do you want to take that one?
Sorry, I'm not sure what type of role it would be. So the question would be, what is it that you're needing to do? Is it to be able to respond to a vehicle accident? Yeah, I think that's part, I think for each organization, one of the things that your occupational health and safety in your organization needs to be able to work through scenarios and anticipate scenarios that you might be in. And part of that is your preparedness to be able to work through what PPE you have, what do you carry with you, if you don't have that PPE. So just similar to what I talked about, we're doing in the SHA, where we're working through scenarios. If we run out of this, then what will we do? What would we use next? We're trying to build a number of contingencies. So I think it's really important for each employer to be looking through those scenarios and starting to think ahead as to what your options are in those kind of scenarios, especially knowing the type of work you do every day. Julie, do you want to talk about that around isolation? If you have, I guess I understand the question would be if you respond to somebody, you don't know whether they're COVID positive or not, and then after you've responded, what you need to do?
Sure, I can try to provide some guidance there. So I think if that happens because of the work that you've done, it's important to be notifying your supervisor that you think you may have been exposed. If the person if the person that you think you may have been exposed to does it in fact is a case, there will be a case investigation around that, and contacts would be notified. So if that's the case, a healthcare worker or a first responder would be notified that they've been identified as a contact to a case. Obviously, privacy prevents us from disclosing names or other personal information, but that would happen if a person is found to be COVID positive. We do identify who may have been providing care and service and supports to that person during the time that they were infectious. So you would be notified that you have been identified as a contact to a case. And then there'd be further guidance provided about your level of risk and what you need to do, whether it's self-isolation or self-monitoring. I think, again, this goes back to understanding that healthcare workers, first responders are a priority population for those reasons, because you may be exposed in your line of work, and then also because of the potential of transmission to others. So it's important, if you do have symptoms that are consistent with COVID-19, even if they're mild, please do get tested.
Thank you. One more additional question onto that, and it's wondering about how long of a wait until the first responders are, I think, aware of, or when the PPE will be available, as I'm assuming what that question is. Katrina, can you answer that one? Oh, sorry. Thanks for that clarification, David. So how long of a wait until we know, or do we self-isolate after a response?
So, sorry, just to make sure I understand, and then Julia, sure. So if you're responding, but you don't know after that response whether your whether that person was COVID or not, I would say that, Julia, I'm not sure if you have a sense of the turnaround between like the case tracings or how long it takes if somebody is identified to contact it. I think it depends on how many contacts there are.
Yep. So when a case is identified to public health, the contact or case investigation is initiated immediately, and within 24 hours, the goal is to identify all of the persons who may be contacts, and then notification of those contacts is happening. So ideally, that's as soon as possible that contacts would be notified that they've been exposed. And certainly, we would want people to be notified within the time frame that is the incubation period for the virus. So within 3 to 4 days is what we're working with as an incubation period, and we'd want to make sure that everybody is aware and monitoring for symptoms during the time that they may develop symptoms, which can extend up to 14 days after their exposure. So that's what the advice is, and why 14 days is that recommended period to be either self-isolating or self-monitoring.
Okay, thank you. We have a couple more questions, so I'll go on to the next one. What type of on-scene decontamination is recommended? Dr. Krzyzanowski, is that something you can answer?
You know what? I don't know if you can answer. I don't know if I can answer that right now, Julie, but I can follow up, Amanda. Julie, do you have an answer to that?
So I think the question might be about like what sort of environmental cleaning and disinfection processes should be followed, and we can follow up with that. I do know that there's also guidance that has been posted on that topic on the Saskatchewan.ca/COVID-19 website that talks about environmental cleaning and processes for disinfection. So I'd suggest you look at that and see how it applies to the particular situation.
Okay, good advice. And just to follow that up, just to let everybody know that Saskatchewan.ca/coronavirus or COVID-19 website is the really source of truth. So if there's any information that needs to be, or the most current information, is always going to be found on that website. It has lots of information on there. So if you're not sure, or if things might have changed, that's your best source, your best resource to find the most current information. We have one more question here, so I will go on to that one. Since many carriers of the virus display no symptoms and members of our group are nurses and paramedics, is there a large risk to us exposing to our families without knowing? So I think Dr. Krzyzanowski will throw that over to you as far as the exposure and incubation period goes.
Sure. And I guess I'll say that I acknowledge this is a concern for many people, right, who are doing this work every day and concerned about what they might be bringing home to their families. So I think it's important to acknowledge that as we get to a point where there's more transmission occurring in the community, that puts everyone at risk. So healthcare workers for sure, but also people who are going about their daily lives, living, working, playing in the communities, and there are many potential, I guess, sources of exposure. So we would encourage people to be alert to the signs and symptoms of COVID-19, and if they think they may be infected and have symptoms, be tested. I think it's important to understand some of the guidance around what do my family need to do if I am required to either self-isolate or self-monitor. So if somebody is required to self-isolate at home because they are infected and a case of COVID-19, then it is required that the rest of the household self-isolate as well. If a person has been required to self-isolate because they've been identified as a contact and they do not have symptoms of COVID-19 and they've not been confirmed to be a case, then it's not required that the rest of the household self-isolate. But it is really important to be alert to signs and symptoms, because if those develop when somebody is in a period of self-isolation or self-monitoring, it's required that they self-isolate immediately. And that's regardless of whether or not they've been tested. So that's really important that if you do develop symptoms of COVID-19, the important thing to do is get tested, but also to self-isolate immediately, and then follow the advice you're given based on the results of your test.
Okay, thank you. So that's the last question we have right now. I'll just remind everyone that for those on the phone, if you have questions that were not addressed here today, you have another option to send in your questions. So again, the email address is spsa spsa@gov.sk.ca. And if you just use the subject line non-health related PPE request for any PPE requests, that same email address is there for those PPE requests as well. So with that, we just have a couple wrap-up slides here for resources. So I'll hand it over to Jack to close us off.
Okay, thank you. Just wanted to let everyone know that the 1-855-559-5502 number, you might have heard on TV last night, is the number that folks can call in to identify individuals who are not following the health order. But the other thing that's really important about that line is that's where you can get any related questions that are non-health related questions. That's manned like 18 hours a day, so use that one. Remember that your PPE requests go to spsa@gov.sk.ca using the subject line non-health PPE requests. SHA also has a Facebook and Twitter page. So the Facebook page is @Sask Health Authority and the Twitter page is @Sask Health. The Integrated Health Incident Command Center, and Felicia, you can take this over because you can explain that part.
They haven't unmuted.
Trying to get you connected on this side, Felicia. Just give us 1 second.
Okay, Felicia, you should be good.
Okay, thank you. So a quick note about the Integrated Health Incident Command Centers. Each of those centers has a liaison officer that's been assigned, and those liaison officers are your link to any questions or more information that you might need about the work of the Saskatchewan Health Authority, especially around pandemic planning. So that the names of those liaison officers and their email addresses are listed in the slide, and we will be sending this information out. So if you don't have that information in front of you, you will be getting it in follow-up.
Okay, so with that, we'd like to thank you very much for spending the last hour and a half with us. Remember that if you have any additional questions, you can use that SBSA line or email. And again, thank you very much. And remember, wash your hands and stay safe out there.
Thanks, Jack. So we do have one more question that came in here. Panelists, I'll leave it to you on whether you want to address that now or if you want to do that as a follow-up. Felicia, Katrina, or Dr. Krasnowski, are you wanting to do one more question or would you like to handle that in follow-up?
It's Dr. Krasnowski. I suggest maybe we could do it in follow-up, and then if there are more questions coming in too, we can address all of those at the same time and keep it open for people to submit any questions they might have.
Perfect. Okay, we can do that. So this last question here from David Sutter, we will handle that in a follow-up. And as was said on this presentation, you're going to get some resources and material sent out to you as well. So stay safe, everyone, and keep up the good work. Thank you.
Thank you, everyone.
Thanks.